Next, we will hear from Lance Chrisman, the Executive Director of Elevance Health Foundation. In this role, Lance leads the foundation's mission to advance health equity by improving health through strategic partnerships with community-based programs that focus on maternal and child health, food as medicine, and substance use disorder. We are so grateful to have Lance with us today to share Elevance's efforts to ensure equitable food access. Lance?
Thanks, Kate. Really appreciate the opportunity to talk a little bit more on the subject, and it's really exciting to be a part of this forum. I think Dr. Seligman did a great job in setting the topic up, defining the size and scope of the issue, and then Matt came in and with his Mid-Ohio Food Collective kind of gave you an idea of some of the systems and things that are in place. And so my goal, when you looked at the agenda, ensuring equitable food access is a pretty big piece of the pie. So what I'd really like to do is just give you an idea from a corporate perspective and more specific to my role, a private foundation or philanthropic perspective on how we are attempting to address the topic and get to some of those. I'll start with the macro and then drill down to some of the programmatic elements. So if you wouldn't mind advancing to the next slide, please. So at Elevance Health, our community health strategy really aims to address those health-related social needs, or some folks call them social determinants of health, through really using as much science as possible, evaluating data, and from that data, building evidence-based interventions, so that we really want to be a part of the solution for health equity. I think that's the most important thing here. So that's at the broad macro Elevance Health perspective. If you go to the next slide, you'll see that we really view this, and this is really for my own, how I keep the buckets straight. We look at two different pathways to achieve this. If you look on the right, you're going to have our business perspective. You're going to have those folks that are driving to improve the health elements of our associates, our members, and our community as a whole, also on the right-hand side. But where I'd really like to stay for this presentation is on the left-hand side here with our philanthropic efforts through our foundation. This is for the broader community needs. It's for the greater good of the community, and really driving home some specific whole health measures, not only for individuals, but for our communities as a whole. So if you can go to the next slide and get into some of the details. Back in January of 21, we sat down with our strategy team at Elevance Health, and we did a full audit of our foundation approach from everything from our analysis, our social mapping, our evaluation of grant activity, to the dollars that were going out the door and what they were going to. And really, it was a 6-month review. Believe it or not, it was a very stringent review of everything that we were doing in the foundation footprint. And the findings came back and they said, you know what, you're doing a good job, doing a very good job, but you're trying to do too much for too many. You're spreading yourself very thin. And so the goal, or the feedback from this refresh, was you need to run deeper and focus on some specific health outcomes in specific areas, and really run deep in those areas. And so from that, we adopted a 3-year goal to spend up to $90 million in 3 primary health focus areas, with an additional focus. Obviously, at the time we were still, and we still are, in the pandemic, so we wanted to make sure we still maintained a focus on disaster as well. But for the purpose of this presentation, we adopted a 3-year goal of spending up to $90 million on 3 primary focus areas: maternal practices, reducing substance use disorder, and then the topic that we're really going to drill down on today, encouraging food as medicine. And I'm happy to say that that goal of 90 million, we are going to exceed that easily. We're going to blow right through it, and it's probably going to be between 100 and 150 million dollars by the time we actually get there. If you can advance to the next slide, I'll show you why. Drilling down into the food as medicine, although I do like Matt's comment on food as health, but we are a healthcare company, so we do stick with the food as medicine. If you could advance to the next slide, please. There you go. So specific to food as medicine, over the next 3 years, we're going to spend at least $30 million on the topic. And we've gone to an RFP process, meaning we define the specific geographies that we want to address food as medicine. We also define the specific health outcomes that we would like to see for the specific demographics. Then we submit an RFP into the community and have our nonprofit partners respond back if they have a program that fits. If you can go to the next slide, you can see over the past year and a half, we've already secured about $23 million and committed $23 million in grant activity. So halfway through, we've already got about 80% of the resources committed. You'll see those are, as I mentioned, we have specific health outcomes related to reducing food insecurity. We want to make sure we're addressing those specific health outcomes, such as reducing BMI, reducing hypertension. There are specific measures with each grant that we're looking at. And so you'll see some of the categories there that we utilize to get there. Next slide, please. This is what I really want to dig in on. Just to give you an example of a couple grants in the area, and at the beginning of this the forum, they were kind enough to say they had assembled a panel of experts, and I would absolutely say Matt and Dr. Seligman are absolutely experts, and I know just enough to be dangerous, but I do know to surround myself with experts. So specifically to kind of give you the 6 degrees of separation, Dr. Seligman was instrumental in helping us shape this grant to Feeding America. This is absolutely the largest grant in the history of our foundation. It's a $14 million grant over 3 years. And to continue with that 6 degrees of separation, Matt, one of our major entities that is implementing the program is the Mid-Ohio Food Bank, which is part of Matt's collective. So small world, but once again, we like to surround ourselves with experts. And this is a great forum. This is our 3rd iteration of the Food as Medicine program. The first iteration really spent the time on screening the patients, creating the intervention. And so with Food as Medicine 3.0, we're really spending more time in drilling down on collecting the data and tracking the data and conducting the evaluation. Feeding America has brought on a 3rd-party evaluator to help us look at the data, dig deep. Once again, you heard me say at the onset, use as much science to the art of this grant giving and impact that we're attempting to create. So we're really excited about this grant, just got it off the ground earlier this year. So we really look forward to watching the impact over the next 3 years with respect to this. So that's at the national level. To give you an idea of a local grant, if you wouldn't mind going to the next slide. A great organization here, actually in Indianapolis, is the Local Initiative Support Corporation, or LISC. We sat down with them and created a $2.45 million grant over the next 3 years to help address equitable food access in needy Indianapolis neighborhoods. We're really utilizing and sitting down and bringing together residents, community leaders, experts on the topic, and civic organizations to analyze the local issues, look at the local resources that are available, and develop achievable strategies to help address the cause. And I just noticed, I volunteered at a community garden on Saturday, and it was actually this community garden that's featured there. I didn't realize that was a photo of it. That's called Elephant's Garden, and it's in a food desert here in Indianapolis. And they have basically 2 residential lots that they have, a community garden on that is generating food and distributing it within that community into the food deserts there and beyond. So great model that is really getting at the grassroots level and leveraging the resources that are available in the local community. So we're pretty proud of that local grant. So just 2 examples of some grant activities that we are engaged in. As I mentioned, we have $23 million in commitments, so there are many, many more across the country, but these were 2 that I thought really highlighted some of the programmatic efforts that we're attempting to put in the community to make a difference. Next slide, please. But it's not all just about the money. We want to be a good community partner. So we've made those philanthropic commitments, but we also want to engage our associate base in volunteerism. Our associates volunteer year-round, but just before the holidays, in the September and October timeframe, we spill into November a little bit, we generate or create a program called Elevance Health Volunteer Days, where we actually structure over 100 planned projects in 30 plus markets across the country, and then we target food insecurity with all of these volunteer opportunities. That's what I was doing on Saturday, as a matter of fact, was part of the Elevance Health Volunteer Days. And so we engage our associates, get out there, they roll up their sleeves, get their hands dirty in, food banks, collecting and sorting and packing food and distributing those, community gardens, so on and so forth. We really use the volunteer days as a springboard into the holidays. And so just through the volunteer days, this year we saw over 15,000 volunteer hours from over 1,500 volunteers. Now those are our associates, but we also use this. We invite their families, they can invite their neighbors, friends. We really use it as a community building opportunity and a culture building opportunity at the same time. And this just adds to, as I mentioned, we volunteer year round. We're going to have over 120,000 volunteer hours from structured events like this in 2022. So, our associates, COVID had them on the sidelines for a couple years because of the mask mandates and weren't able to get out there and volunteer. So now they're hitting the ground running and making up for lost time. So we're glad to see it. So that's really it. Next slide. Really, once again, thanks for the opportunity just to give a few examples of what we have in place, and I look forward to the Q&A session.
Great, thank you so much, Lance, for highlighting Elevance's leadership in supporting community health and food as medicine programs.